All right, Maz asking, is it possible that children are not spreading the virus in school because they, like many parents suspect, all had it last year? Since the antibodies don't always last or show up, what can you tell us about T cells in terms of protection? And is there a way to test your count in terms of this virus?
So let's break your question apart into a few different sections. The first is, while many children did have COVID, perhaps were asymptomatic and we didn't know it. In fact, many more children did not have COVID. So thinking that them going to school or not getting COVID or getting COVID and being totally well is unfortunately not true. There are too many children who have not had COVID, who have parents and adults in the household who are at risk. And if they get COVID, while they may not be sick, they certainly will spread it to the parents and the elderly people in their households. With regard to antibody production, there's a couple of really nice studies, only in adults unfortunately so far, that show that those adults that made a low level of response to the illness had antibodies that waned after just a few months, 3 to 6 months, their titers were gone. Unfortunately, when you look at antibody response to the virus, we look at antibody production. It's very difficult to measure T cell response, that sort of hidden response that when you see the virus a second or a third time, your body remembers and says, oh great, let's make an immune response and fight it off. We don't have those good enough tools to look at those patients that had asymptomatic infection in the past. First, we have to find them. Then we have to do multiple blood tests on them and then follow them to actually see how they're going to do. On the other hand, for those patients that got vaccinated, we've been able to measure their antibody response right away, several months later, and then many months later, as well as look at their T cell response.
Okay.
And those responses seem to be much better than those who got infection.